Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, we answer your questions about mental health and COVID-19. Stephanie Desmond talks to Dr. Laura Murray, a clinical psychologist from Johns Hopkins, about the long-term impact of the disruption caused by the coronavirus on kids and adults. Let's listen.
Dr. Laura Murray, thanks so much for being with me.
Thank you for having me again, Stephanie.
So we're going to do some of those mental health questions and answers from our listeners. And the first one I want to start with is the CDC survey people may have been hearing about. One of the things that really stuck out to me was that how young adults are really suffering here. So according to the CDC, 75% of 18 to 21-year-olds reported at least one mental or behavioral health symptom in a recent survey, and a quarter said they had a serious suicidal ideation. Talk to me about that.
Yeah, those are very high rates for sure. And we're seeing more and more of these surveys come out about the mental health aspects of COVID-19 over time. And I think there's a couple things to look at. I mean, first of all, we should take these seriously to the extent of let's make sure we keep reaching out to those around us, our friends, our loved ones, maybe even people we don't know that well, particularly because we're seeing suicide rate. So try not to be shy about reaching out, just checking in. How are you doing? Maybe make sure you give some self-disclosure that this is really hard for me too. I'd love to talk with you about it, just to make sure we're reaching out to people, because I think we do need to take these numbers into account. I will say the other thing to keep in mind with these surveys is that we are all living through a situation that is higher stress. And so we're going to see higher numbers of stress reported. And as we've talked about before, Stephanie, the stress is so wide and diverse. Sometimes it has to do with health, sometimes it has to do with economics, and a number of other things. So we really want to make sure that we also keep in mind that this is somewhat of a normal reaction to a really crazy and different time that we're going through. And then the other thing is just keep in mind, most of these surveys, which I believe the CDC is included in that, didn't do a formal evaluation as far as diagnostics. So they're sort of asking people baseline questions. So that's something to keep in mind too, but still cause for concern, of course, and something that we really want to encourage people who maybe aren't acting like they normally do to reach out.
We have a question here now about kids. You have kids, I have kids. We're seeing them every day and seeing what this whole situation, this strange situation is doing to them. So I guess the question is sort of, let's talk a little bit about all the things kids are losing and missing out on, and how can we get kids to talk about their feelings? Because I know they're having them.
Yeah, so true. And I being a parent, you really realize that not only do you have to pay attention to, of course, kids, but all the kids are different. I know you and I have talked about this. Our daughter might be experiencing something very different than our son. And that's really something that parents should be very mindful of right now, especially because there's less interaction of other adults around your kids, right? There was always different teachers maybe, or different coaches, or different people around our kids. And so now parents might be some of the only people actually observing, their kids and how they're doing. And gosh, as we've talked about before, kids are losing so many things: opportunities, big experiences, milestones in life, economic and academic opportunities. So I love that the question included how to talk about feelings. That is such key importance. So one of the things is just really make sure that you are asking kids how they're feeling and making sure there's an open line of communication. Now that's awkward for most kids, especially from parents. They're like, oh God, Mom, do not ask how I'm feeling. So a couple tips on this. One is use self-disclosure, say, oh gosh, today was a really hard day. I was at the grocery store and this happened and someone had their mask down and they sneezed and I got really anxious and, or I haven't been able to see my friends or, we haven't been able to see grandpa and grandma for so long and I'm just feeling sad about that. That sort of opens up the conversation a little bit more without that targeted question of like, how are you doing? How are you feeling?
I'll tell you, my teens do not answer that one real well.
No.
If you listen to them, they tell you they're just fine. But I know I like this idea of saying, I feel this way, and just to make them understand that they're not alone in those feelings, right? I mean, that's why we do that.
Absolutely. The other idea is to actually ask about thoughts. And so this is often seen as less invasive for kids. So, you might say, let's just everyone give one thought about what they think about this crazy coronavirus. And what's interesting is it just opens up those lines of communication a little bit more. So it's not a taboo subject. It's not something that they avoid. And then again, it's an opportunity for us to share. I'm really fatigued with this whole coronavirus, or I'm ready for it to be over. To really get a sense. Just as an example, I think I got one flavor from my daughter who is tired of it. And my son was like, I'm actually enjoying it. The whole family's home. So it's a very interesting dynamic where you really, do a little litmus test on each separate kid.
That's really good advice. I'm taking notes, of course. One thing that I'm seeing is sort of this numbing to COVID, when the first lockdowns were happening and you had to go to the store, I mean, it was like my heart was pounding and I was so nervous with everything that I did. And I was wearing gloves and I was so nervous. And, I went to the grocery store the other day and it was, it was just like going to the grocery store any other day. So talk to me about what's happening here.
Yeah. Such an interesting phenomenon. And so what's essentially happening is we as human beings perceive risks that are acute, like a hurricane or a tsunami or something, very different from how we look at chronic risk. Car accidents, for example, or like COVID now. So COVID in March, April, May, we perceived in a certain way. And now it's moving into more of a chronic view in our minds because it's been with us. And it's something that really comes from what we talk about in psychology as habituation, or the more we're sensitized to something, it becomes less of a threat, less intimidating. A very simple example is if you have noise in the background, you're eventually desensitized to it. So lots of times people study at Starbucks and they eventually just don't hear anything in the background. We actually use it to help people with extreme phobias. If they have an irrational fear of, a bug or something, we actually give them the bug to hold. And so by having it around them, we sort of limit that perceived risk. So, and I think it's happening everywhere, and it's just something to be aware of that's probably going on with everyone a little bit.
Is that dangerous, though? I mean, if we are getting used to this extreme risk, are we going to take more chances? Are we going to put ourselves at higher risk unknowingly?
Very intuitive question. I think it depends on who you ask. I think there's a lot being written about this now that we're moving from acute to chronic. So something to sort of keep your eye out for. I think scientists are worried that people are getting to a point where they're sending their kids to camp and now they're sending their kids to school and everyone's going to the grocery store and they're sort of worried about this and wondering, how many more rules do we have to make in order to pull our behavior back? I don't think that means that everyone's taking crazy risk. I think people maybe are weighing risks in a different way.
I accidentally touched my face after I was at the grocery store before I used hand sanitizer. And now I keep thinking that never would have happened in March. And so here I am worrying that that's something that I've now infected myself. So it can get a little nuts, right?
It can, absolutely. Well, and this is just to bounce off that, Stephanie, this is something that we're working with a lot of people on about trying to distinguish between productive worries or thoughts and unproductive ones. And a lot of us have moments like you. even I was outside and my son actually had a baseball game and we were distanced and outside and lots of people wearing masks, but still you start to question these things. And it is time to take a step back for our own mental health and sort of say, okay, is this a worry that's productive? Is this something that's going to make me go back to my decision base? Or is this something that's just getting me spiraling out of control and leading to some of these statistics that the CDC and others are finding?
And I have one more question here about sort of compassion and blame. We're all seeing people, and this is something we've been dealing with all along. We're all seeing people who aren't quote unquote following the rules or maybe are making decisions that we wouldn't make. I was actually reading something today about how people are not posting pictures of their vacation on Facebook because they're sort of shamed about it. People who have actually gone on vacation feel like they shouldn't maybe have gone on vacation. Even if they took all the precautions, they don't want to advertise to the world that they did this. So I'm wondering, how can we reconcile those feelings?
Yeah. Well, I'm in the same boat. I mean, I'm second guessing decisions left and right here. And most of the people we talk to also, I think compassion is such a great word. I do think it's harder to achieve than it is to talk about, right? So when we talk about compassion, we're sort of saying we want to infuse ourselves with some sort of positive thought, positive feelings, that we're doing the best we can with tough decisions and quite frankly, a lot of uncertainty. One of the things that we talk about as far as how to get to compassion for yourselves is really accepting uncertainty. That's a hard thing, but accepting that there is no right answer. There is no absolute certainty that we're not going to get it at any one time, and that's hard. One of the best ways to do that is monitor what you're saying to yourself. Are you saying to yourself, I shouldn't have made that decision, or what if this, or what if that, versus, you know what, that's the decision I made and we've got to, sort of move on. One of the analogies I really love in psychology is that having a thought doesn't mean you've actually bought into the thought. And so I tend to have sort of a thinking mistake of catastrophizing, right? So, I have I would be like you. If I touch my eye, I'd be like, that's it, I have COVID. That's just where my mind goes. And what's interesting is to sort of say, here is my mind again going, which is normal, but I'm not going to buy into those thoughts. And here's the thought I'm actually going to buy into. So it's not necessarily about stopping those thoughts, but it's about recognizing that our brains are going to do this and we're all going to have days of doubt, but trying to move beyond that onto sort of accepting uncertainty and just having a little, compassion for ourselves and of course others.
Laura Murray, thank you so much for joining us.
Always good to be here. Thanks, Stephanie.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.